Okay, so today we are going to say what is jaundice, and in this jaundice, we have seen about the introduction. Okay, so jaundice, the other name for it that we called as icterus, and that is the yellowish or the greenish kind of pigmentation that is generally seen on the skin and in the white of the eye. And this kind of pigmentation, that is the color, is caused due to bilirubin. Right. Now this bilirubin, when it increases, it leads to the development of jaundice. Normal level of bilirubin, if we talk, it is about 1 milligram per dl. But if its level rises to about 2 to 3 milligram per dl, we can say that the patient is high bilirubin, and if the patient is, typically it results in jaundice. And if we talk of about jaundice properly, it is not a disease, it is a sign which is a representative of many different diseases. Next point, that is epidemiology. We see approximately 40,000 patients per 1 lakh ICU patients suffer with this jaundice, and it is, if we talk of about the prevalence in adults, it is very rare, whereas it is very common in babies. That is about 80% of the babies are affected during the first week of life, and that we called it as the infantile jaundice or neonatal jaundice. Also, there is epidemiology depending upon the gender, where males are more commonly affected by hepatocellular and the liver cancer as compared to females, whereas females are more commonly affected by hemolytic jaundice. Depending upon the age, we can say hepatocellular jaundice, which particularly results from viral hepatitis. It commonly affects younger people. And cholestatic jaundice, that is also called as the obstructive jaundice, which develops from liver cancer, hepatitis, and liver cirrhosis. This typically affects the older people. Clear? But to understand this, we need to understand the normal metabolism of bilirubin, and we need to understand it by dividing it into four different compartments. The first compartment, that is the reticuloendothelial system. Second is the bloodstream. Third is where your liver comes into action, and the fourth one, that is gut. So in reticuloendothelial system, the RBCs, which has heme, it results in the development of unconjugated bilirubin. This unconjugated bilirubin, along with albumin from the bloodstream, it enters off into the bloodstream, and it forms a complex that is unconjugated bilirubin albumin complex. Also, we call it as the indirect bilirubin. Okay, this indirect bilirubin moves to the liver cells, where it combines with an enzyme, that is uridine glucuronyl transferase, that is GT, and that forms direct bilirubin, or called as the conjugated bilirubin. This conjugated bilirubin or direct bilirubin enters off into the gut, where with the action of the gut bacteria excreted in the bile, it's converted into, so the cerobilinogen, with the action of the gut bacteria, it gets converted and starts excreting, where 80% of the excretion is through feces, that is in the form of stercobilin. 2% of it is excreted in the urine in the form of urobilin, and 80% of it enters off into the enterohepatic circulation. That is, again, it goes to this direct bilirubin or conjugated bilirubin. So this is the metabolism. If we talk of about the types of jaundice, remember there are three major types. First is prehepatic, second is hepatic, and the last one, that is the post-hepatic type of jaundice. Now this prehepatic, that is called as hemolytic jaundice, which is where the reticuloendothelial system or the pathology is within this particular portion. Hepatic jaundice or hepatocellular jaundice is the type where pathology is present in the liver, and the third is the post-hepatic type of jaundice or the obstructive jaundice, where the pathology develops either in the liver or in the gut cells. And one by one, if we seek to understand the different types of jaundice, the first one, that is prehepatic jaundice. As I told, here the bilirubin level would be disrupted prior to the transportation in the liver. Examples are hemolytic anemia and sickle cell disease. Second type, we can see, that is hepatocellular jaundice. Here the disorder that is caused in the liver, and examples include liver cirrhosis and Gilbert's syndrome. The third form of jaundice that we have is post-hepatic or obstructive type of jaundice. Here the bile and therefore the bilirubin which is contained inside is obstructed and is converted it is prevented from draining into the digestive system from gallbladder, and the examples of it includes tumors and gallstones. And the last very commonly seen type of jaundice called as the infantile jaundice, which is most commonly seen in the preterm babies, and it occurs because of the fact that the baby's liver cells are not mature enough to quickly remove the bilirubin from the system, and that causes an excess of bilirubin. Causes include cancer, hepatitis, alcoholic liver disease, liver cirrhosis, gallstones, pancreatitis, congenital disorders, and like. Next, we are talking about some of the risk factors which are commonly contracting jaundice. The first one, that is cholestasis. Here it is a condition that can disrupt the bile flow that is coming from the liver. The conjugated bilirubin contained in the bile stands behind in the liver without being taken out. Second is the Gilbert syndrome. Gilbert syndrome, if we talk about, it is a condition that is inherited which can lead to an impaired enzyme ability to continue the bile's excretion process. Third is the hemolytic anemia. Here the bilirubin can increase when increased level of red blood cell go through breakdown process. Fourth being bile duct obstruction. This kind of condition, it contributes the liver from being prevented and excreting bilirubin. Fifth one, that is bile duct inflammation. This can have the bile removal and secretion prevented, and that results in jaundice. Sixth is acute liver inflammation. This can lead to impairment of the liver in the conjugation and the secretion of bilirubin, which can lead to waste accumulation. Symptoms, if we see, we have itchiness, abdominal pain, weight loss, vomiting, pale stool, fatigue, yeah, and dry urine. Sorry, that comes as dark urine. Okay, so talking about the diagnosis, the first thing is a blood test. The blood test that is performed to confirm the diagnosis of jaundice, and that includes tests such as bilirubin, FBC, and hepatitis ABC test. Second is go through a thorough medical history of the patient, as it is a sign which is present in many disorders. Physical examination, where one needs to feel for any kind of tumor seen in abdomen or to check the firmness in the liver. So if the liver indicates that the liver is having a firm liver, it indicates liver cirrhosis. Whereas a hard liver, it indicates towards liver cancer. However, tests that are usually needed to confirm an exact diagnosis, and you can say this is just the talk that I am having it with you, that various blood tests are done, and this will show that whether the raised level of bilirubin is conjugated or unconjugated, and this further helps to narrow down the possible causes of jaundice. So as with the liver function test, which will measure the various liver enzymes to see for liver inflammation, also detect virus and markers for other infections that affect the liver. There is urine test that is to bring down or narrow down the possible causes of jaundice. Ultrasound scan commonly to see bile duct and pancreas and identify the cause related to CBD like gallstone or CA pancreas. MRI and liver biopsy. If we see about the treatment portion, treatment specifically is to target the specific cause. If it is hepatocellular jaundice, certain antiviral medications and steroids are given. Hemolytic jaundice, treat with iron supplements. Obstructive jaundice, treat with surgery or the removal of obstruction, which is followed by medication. There also is medication induced jaundice. In such cases, the medicines are discontinued and alternative medicines are to be given. For infantile jaundice, treatment part, that is phototherapy and blood transfusion. Thank you. That's all for jaundice from my side. Hope it proves useful to you.